Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an innovative and unique show for you tonight. We're talking about around-the-clock care, and we'll be discussing what services are best suited for patients when determining their healthcare needs. We'll be joined by a panel of medical experts from the emergency department, St. Luke's Care Now, and family medicine. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at around-the-clock care with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have a dedicated panel of guests joining us tonight. Up first, we have Dr. Robert Delansky. Dr. Delansky is an osteopathic family physician, and he's been with St. Luke since finishing medical school in 1995. Working with the Family Medicine Residency Training Program and a traditional family medicine practice office for many years, Dr. Delansky also picked up extra shifts at the Urgent Care and Occupational Medicine Center at St. Luke's. Making the leap to urgent care medicine full-time in 2013, he helped open St. Luke's Care Now Walk-In Center at West Allentown. In the following months, he became the Network Medical Director for Urgent Care Services and has opened several new Care Now Walk-In Centers across the region.
At St. Luke's Care Now, you become part of our family. I think I first became interested in medicine when I was a child, and I went to visit my grandfather in the hospital and just was enthused by all the wonderful people taking care of him. What I like most about my job is I get to interact with a lot of different people in a lot of different areas. Care Now is a nice option for patients, especially when they can't get into their family practice centers. St. Luke's Care Now centers are designed for easy access for all of our patients within the area. I think that it's important to have easy access because we all live such busy lives. We do recommend that you contact your family practice office first, but oftentimes on evenings and weekends, you can't get in. That's why we're available. My hope for the St. Luke's Care Now centers is that you can easily access one of our centers within a 10 to 15 minute drive and get in and out within an hour.
Thank you so much for being here, Dr. Delansky. Can you start by telling us what precautions has St. Luke's taken at the Care Now facilities during the COVID pandemic? People are nervous about going to the doctor and coming in for any kind of care, especially urgent care. When they come to Care Now, what can they expect?
Sure. Well, first of all, the whole network has established a universal masking policy where all of the employees are wearing masks. So when you walk in, you're safe right from the very beginning. However, if you do think about it before you come to an urgent care, we always recommend you start out with your family doctor. Give them a call. They might be able to help you over the phone or give you some advice until they can get you into the office or until they can get a virtual visit with you. But if you do enter, we do have kiosks where you sign in. They are cleaned on a regular basis. All of the chairs in the waiting room are at least a 6-foot distance apart from each other. There are cleaning wipes where you can clean down the chair again for yourself if you wish to. All of the receptionists are behind glass. So it's a very safe environment right from the start.
Great information. Thanks, Dr. Delansky. Joining our panel next is Dr. Eric Eustace. Dr. Eustace, a native of Detroit, joined St. Luke's in 2016, where he's worked in several of the network's emergency departments. He has a current leadership role as Vice President of Medical Affairs for St. Luke's Sacred Heart Campus, as well as their Emergency Department Director. Dr. Eustace enjoys the fast-paced environment of the emergency department and was drawn to the field because of the wide variety of patients seen in one day or even in the same hour. In his spare time, he enjoys spending time with his family, fishing, and cooking.
Leading up to becoming a doctor, I was involved heavily in my high school back in Detroit with service opportunities. And then from there, what really drew me to emergency medicine after I went to med school was that we saw a wide variety of different patients on the same day, maybe even in the same hour. The majority of the patients that we see have some sort of illness that needs to be taken care of right away. And we're always open 24 hours a day, 365 days a year to take care of that. It takes a lot of practice to become very calm in high stress situations. A lot of it has to do with your mindset internally and how you present yourself on the shift. It allows for a different variety every day. So no one shift is the same. Most of the time when patients come into the emergency department, it's the worst day of their life. And so my job is to make sure that somebody's comfortable, somebody feels safe, secure, and to help them do that while they're feeling ill.
Welcome, Dr. Eustace. What do you want to tell patients who may be nervous about going to the hospital in an emergency, but they really need to be there?
What we've done is we've actually separated our waiting rooms from possible patients who might have COVID symptoms, and then patients who would come in for their regular heart issues, their abdominal pain, chest pain, strokes, heart attacks, the like. So we've actually partitioned our waiting rooms. So you're able to come into the waiting room, and if you have no COVID symptoms, you'll be ushered into a place away from those patients who suspect are COVID positive. Will be taken in a different part of the emergency department. Those patients that are COVID positive, we've actually designated sections of the emergency department. So we have dedicated nurses, dedicated physicians that can take care of those patients in a very seamless, effortless fashion.
It's really comforting to know, and it reminds me a lot of often the pediatrician's offices have the sick waiting room and the healthy waiting room. And it's good to know that that protocol has happened. Let's meet our final panelist, Dr. Tiana Shikari. Being a physician has been a lifelong dream for Dr. Shikari. From the age of 8, she knew that she wanted to help people as a medical professional. After growing up in the Lehigh Valley and attending Muhlenberg College, Dr. Shikari joined the St. Luke's team in 2005. Working as a family medicine physician, she's able to engage with a wide variety of patients in both preventative and diagnostic circumstances. Beyond medicine, nothing is more important to Dr. Shikari than her family and staying active in the community, supporting several nonprofits and volunteering on her hometown civil service board.
I think we're just really good at what we do. Hi, I'm Tiana Shikari. I am a family physician with St. Luke's. I am also the medical director of the central region of our primary care offices. I have been with St. Luke's for 18 years. We have a great network of specialists. We have great facilities. The communication back and forth between specialists and primary care is fantastic. We have lots of roles as a family physician. How do we keep you healthy? By doing your health maintenance. We do a lot of disease management and also disease prevention. We have a very complete circle of communication in our network, making sure they're doing everything that they need to do for health maintenance at that age group. In other words, have you gone for your mammogram at age 40? Have you had a colonoscopy at age 50? Are you getting your preventative vaccines at the appropriate ages? So those are all very important things that we do at an annual physical. And so seeing them at least once a year, we can kind of get them on board towards better health.
Welcome, Dr. Shikari. You are in primary care, and a lot of patients need to have their regular checkups with their doctor. So what are you doing to encourage your patients to come in and see you and other primary care physicians during this time?
So we've eliminated our waiting rooms, essentially. So they do their check-in with the receptionist from their car. They come into a kiosk where essentially the medical assistant takes their temperature. Everybody is masked, just like Dr. Delansky said from the beginning. They come into the room and back into the room, and they wait for us after they've had their vitals taken, and they do not check out anymore. So they go back out to their car, and they get further instructions about lab work from their car. So essentially eliminating anywhere where there would be multiple patients waiting to check out. We no longer have that anymore.
Well, thank you all for that information. We're going to take a quick break, but when we come back, I want to dig a little deeper into the differences and what kind of care each of you provide, how you continue to communicate, and when patients should go to these various services at St. Luke's. Stay tuned. You're watching St. Luke's Health Now. Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program and for providing us with questions for our panel before the show. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Delansky, Dr. Eustace, and Dr. Shakari. We've started to discuss how the network is prepared for patients and the steps being followed to ensure safety and sanitation. Now let's get a better understanding of how a patient can determine the best place to go to get their care during the pandemic. Let's get into the differences between these different facilities and types of doctor's appointments. So Dr. Delansky, when does a patient come to CareNow? You're sort of the go-between between a primary care and an ER visit?
A lot of people think of it as that, but we're basically an extension of your primary care office. So we do recommend that you give your family doctor a call before you come to an emergency room, because they might be able to help you over the phone or get you in to a virtual visit or into the office. But we're definitely there for your coughs, colds, bumps, bruises, minor lacerations, things that you don't necessarily need to go to the emergency room for, but you definitely need care quicker than you might be able to get into your family doctor.
You mentioned calling ahead and maybe seeing your primary care first. So Dr. Shakari, I want to turn to you. When should patients come to see you? What are the kind of routine visits that you would expect to go to your primary care for and that you want patients making sure they're booking with you?
So right now we're doing, especially in the summertime, we do a lot of pediatric physicals. We're doing a lot of adult well visits right now. And in those visits, we're catching patients up on their health maintenance for women, making sure they're getting their mammograms, 40 and over for colonoscopies. Right now, we're also offering virtual visits. So our patients that are having those cough, cold symptoms that don't want to be coming into the office, we're doing those virtually. And those have been going really, really well.
And virtual visits have really been on the rise. I know that St. Luke's has seen over 100,000 patients virtually with all kinds of specialties, but there are times when you've got to go to the emergency room. So Dr. Eustace, what are those examples? What are the symptoms and the situations where you say, come right to us, come right to the ER?
I think if you're experiencing any type of distress, so that's problems breathing, severe pain, if you have chest pain, abdominal pain, anything that you would deem as an emergency, or if you need to call 911, those would be the times we're taking care of you in the emergency department.
That's really good advice. And you guys both have mentioned virtual visits. So Dr. Delansky, I want to ask you, in addition to the CareNow facilities, tell us a little bit about the St. Luke's app. How can patients utilize that to help with their continuity of care?
Sure. With the St. Luke's app, you can click on the virtual visit link and you can get a physician, a St. Luke's provider, within minutes. And it's very easy. We've been doing this for over 6 years, and we can take care of a lot of coughs, colds, minor urinary tract infections, minor musculoskeletal injuries, just with a simple phone call.
It's pretty cool that we have that capability. Dr. Shakari, often in primary care and pediatrics, the relationship with the patient is so important. You really develop that over many, many years, sometimes many generations. Tell us a little bit about how things like technology, the app, virtual visits have changed that, and have they enhanced it in some way?
Well, I think the neat part about it is we were a little bit unsure of how many patients were actually going to be able to do virtual visits, depending on their age and their ability. And we were a little bit surprised how many patients actually jumped on the platform and were able to do a lot of the visits virtually. And they didn't actually need the help of their younger children or even grandchildren. So we were pleasantly surprised at how well they were able to position their phone so that they could show us certain things. Because some of our virtual visits, we needed to take a look at swelling in their legs or a rash, and they were able to actually adjust the camera and show us pretty well. So it's been really, really nice to have that option. But also generationally, there were patients that did have help.
I love that
extra
story.
help.
Yeah, it's nice, nice bonding and family time. If you have to have some sort of medical visit, that's important. Speaking of family time and the difficulties around some medicine, Dr. Eustace, when someone comes into the emergency room, often they are really in a situation where they're scared, they're frightened. Things are very heightened right now with fear in general about people's health. What is your approach, and what is your team's approach to kind of alleviate those fears and treat your patients the best way possible?
So what we do is we allow visitors to come back to be with their family members. So what happens is when you come into the emergency department, you're quickly escorted into a room. A nurse will start asking specific questions, taking vital signs, asking about the complaint you're having. We've also developed at St. Luke's, we utilize this a lot, is a team management approach in triage. So what you actually have in triage is somebody from registration to get your information, such as your name, your date of birth, your insurance information. Also, then you'll have an emergency department nurse who will take your vital signs and gather the history. But one thing that we do specifically at St. Luke's is the physician comes in right away with that triage nurse. So we're actually gathering the information at the same time, as opposed to having one person ask you the same question over and over again. Your doctor is actually in the room when they're asking those initial questions, so you won't have to repeat yourself multiple times, which is very helpful, and it's a great patient satisfier. It also allows for the doctor to see patients a little bit more quickly, so you're not waiting too long to see a provider by the time you get right into the emergency department. We also institute a pull to a full method, meaning that if we have open beds, we're going to bring you right back to an open bed. We're not going to allow you to wait in the waiting room if we have open capacity. So that helps us move patients through very quickly. Patients are very satisfied, and they're seen right away when they come in if there's open beds.
That's really insightful information. And I think it's a big reason people are hesitant to go to the ER because of that perceived wait time. So to know that you can get rid of some of that is really nice. After the break, we'll learn more about treatment options and patient care. You're watching St. Luke's Health Now. Stay tuned. Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a fascinating show for you tonight. We're talking about around-the-clock care. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. Delansky, Dr. Eustace, and Dr. Shakari. Thank you guys all for being here. In the first part of the program, we talked about the safety precautions the network is following and where to seek care that can best serve your needs. Now let's dive into treatment options and patient care. So I'll throw this out to you, Dr. Eustace. When someone comes to you, they're not quite sure what's wrong, and you follow through the process, what happens next? Where do you refer them, and what are the next steps after they've seen you in the emergency room?
Every patient, what we recommend from the emergency department is to follow up with your primary care provider. Now, in some instances, if you don't have a primary care provider, there's resources that we can give you to link up with specifically a St. Luke's provider or even a specialist. So for instance, if you need to see a gastroenterologist, a GI doctor, a neurologist, we will actually make recommendations, and at times we can even communicate with those physicians to link you up, so that you might actually receive a phone call from them in 3 or 4 days, depending on what we would recommend. So there are ways that we can actually link with the outside providers to make sure that you have close follow-up.
That's great. And Dr. Shakari, when patients come to see you and maybe they've been to the emergency room or they've been to St. Luke's Care Now, how are you approaching their care? And is it something where you are kind of bridging those? What's the communication? How do you know what happened in those other care situations?
So Ashley, just like Dr. Eustace said, we have a couple different platforms that we communicate really well together. One of them is through our computer system, our Epic system. We can see everyone that has come in through St. Luke's and what was done for them while they were in either our Care Now or our emergency room. And the other one is that we have a secure texting system within all of the physician and providers throughout St. Luke's that's HIPAA compliant. And oftentimes when one of the emergency room or one of the Care Now physicians wants us to get a patient in quickly into our primary care offices, often they'll send us a message just saying, by the way, I saw your patient today, nothing that needs to be done today, but could you please get them into your office tomorrow, and here's what happened. So our communication, honestly, is fantastic. And this is kind of what makes our network great, is that we communicate really well amongst one another.
Dr. Eustace, when someone comes into the emergency room, how equipped are you to handle various situations? And how important is it that you're a part of a bigger network? You are more specifically at Sacred Heart campus, but there are many, many campuses throughout the network. And tell us a little bit about where someone would go and what kind of care you can provide by being a part of a bigger network.
So all of our emergency departments within the network are equipped to deal with any type of emergency. So if you come in, we're able to handle it. Now, that being said, I do work at Sacred Heart Campus, which is a smaller community-style campus of emergency medicine. We have a smaller team, but the great thing is we're part of a larger network. So, for instance, if you come in and you're a trauma victim, you're in a bad motor vehicle accident, and there's certain things that need to be performed on you, such as possibly trauma surgery or a trauma evaluation. Some campuses don't have that capability. But we're always a phone call away with the trauma facility or even a certain specialist at our other larger campuses, such as Fountain Hill or Anderson, to be able to take care of you.
I want to ask you all, we've talked a little bit about the differences in the type of care that you can get at your facilities. There is crossover, but I want to ask you each the same question. I'll start with you, Dr. Delansky. What do you want patients to know about HealthNow and the availability of care to them, depending on what they need at St. Luke's?
Well, if they're ever in doubt, they can come in and we'll definitely evaluate. We don't turn anyone away. So we'll evaluate you. And if it's something we can take care of that your family doctor could have taken care of, we'll do that. But if it's more an emergency situation where you need to be seen by an emergency room physician, we'll definitely get you there too. We'll definitely give a call ahead just to find out what the wait is and let you know what would be the best emergency facility to go to.
And what about you, Dr. Shakari? What do you want patients to know about having a primary care physician and the important role that you guys play in people's overall health and wellness?
I think one of the things that we really enjoy as primary care physicians is, since we do take care of newborn and up, is just watching patients grow from generation to generation and growing that trust and knowing that if they do need care from specialists and outside of our capabilities, that we are referring them to our St. Luke's specialists that they know that they can go to because they trust us.
And what about you, Dr. Eustace?
I would say any time of day, any day of the week, we're here for you. So especially in the emergency department, we're always open. So if there's ever a question of whether you should see a physician and you're questioning, at 3 a.m., do I really need to come in? Come on in, we'll take care of you and make sure that you're safe and sound, and then treat anything that needs to be treated.
Well, I can really feel the care and the concern from all of you, and I hope that our viewers can feel that as well and know that they can get care anywhere in the St. Luke's network. Up next, we're going to take questions from our viewers, so stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. I want to thank our outstanding panelists. We've had a great conversation about around-the-clock care at St. Luke's, where you can get your care, how you can get it, and when. So now we're going to take some questions from our viewers. All right, Dr. Eustace, I'm going to start with you. The first question is, how do I know if I should call 911 or drive myself to the ER? That is a good question. I always think dial 911, but I think people hop in the car a lot too.
I think if you're debating between the two, if you can wait and you feel safe enough to drive, then you can drive. But a lot of times if you're dizzy, if you feel severe pain that it would be a danger for you to get in the car, that's when I would call 911. If you have no one else to drive you, then I would call 911. I would say also too, if you're contemplating calling 911, then probably a good chance that you probably should. Then even if it's not a true emergency, the medics can come out and evaluate you, and you can determine then if you would like to go with them, or they might even say, no, I'm okay, I can drive myself. So it's in best interest, if you're contemplating it and it's a question, then I would call 911.
That is a good reminder that if you call 911 and the ambulance and the medics come out, they have the capability and the knowledge to analyze you and the situation and maybe give you some advice as to what should happen next. So that's really good advice. All right, the next question I think is for you, Dr. Delansky. What is the benefit of calling ahead and using the St. Luke's app?
Well, you don't necessarily need to call ahead to come to the HealthNow, to the urgent care centers. However, if you do check the app or even the St. Luke's website, you check the location for the hours, there's a skip the wait button. And if you click that button, it'll basically put you in line for that center.
All right, here's the next question that we've got. I think this is for you, Dr. Shakari. Do I need a primary care provider, or can I seek out specialists directly?
So I think there are so many things your primary care doctor can start a workup on. And I think you can start with us and we can start doing some blood work and trying to figure out exactly what's going on. And then if there are things that need to be sent to the specialist, then we can send you to the specialist. But definitely your first stop is with us, and we can try to figure out where the problems are and where the issues are and get you feeling better first. And if if we still feel like you need to go to the specialist, then we'll refer you off to the specialist.
Excellent. Well, great advice from all of you. We're going to end the show by me asking you each to answer a question. What do you want patients to know about the care they can receive during this time and COVID-19 and the fear that's out there? St. Luke's is here for our community. You've all done an amazing job of serving us, of pivoting and of being available. What's your final message to patients? We'll start with you, Dr. Eustace.
I would say it's safe to come back to the emergency department. For a while there, at the height of this pandemic, we did see a decrease in volume of patients coming in because I think patients were scared to come into the emergency department. But especially in this COVID-19 era, it's safe. We're taking every precaution to make sure that you are protected and you are not at risk for catching COVID-19 when you come in and visit us. And we're here for you.
Certainly. Dr. Shakari, what about you?
Yeah. I would absolutely echo the same message that we are back open. And actually, primary care offices, we didn't close. We never did close, just like the emergency room didn't. We were always open, and the volume kind of decreased at one point, but we're seeing more and more patients come in. We're absolutely safe. We're doing things to keep patients safe. And we want to make sure that everybody knows, please come in and see us. And we're doing things to make sure that you can feel comfortable when you come in and to keep you safe.
What about you, Dr. Delansky?
I think the only thing I can add is that St. Luke's has an excellent group of infectious disease specialists that have been on top of all of the COVID-19 information. They're constantly looking at the research. They are looking at the CDC guidelines, and they're helping us to decipher that information so that we can be the safest place for our patients and take care of our patients in a great environment.
Wonderful. Thank you so much, all of you, for joining us. Dr. Eustace, Dr. Delansky, Dr. Shakari, for giving us more information about St. Luke's around-the-clock care. For more information on around-the-clock care at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.